My name is Kathryn Hicks,
And my name is Jacob Branch.
and we're presenting physician-assisted suicide and the challenges that nurses face when dealing with patients who would like assisted suicide.
Today, I'm going to give you a scenario here. Here we have an 89-year-old male who has smoked his whole life. Mr. Smith has been diagnosed with lung cancer. He also has COPD and emphysema. Mr. Smith is unable to perform any activities of daily living. Mr. Smith is currently receiving 6 liters of oxygen per minute through his nasal cannula. Mr. Smith once stated that each breath his pain only gets worse. The patient received the prognosis 2 years ago, stating that he only had 1 year left in his life and has outlived those expectations. So the question is, do you help him assist himself in suicide?
My patient is 26-year-old Emmylou Harris. She is dying a slow death from chronic lymphatic leukemia. Ms. Harris was diagnosed with this disease when she was 16 years of age. She has outlived the 10-year prognosis by a few days that the doctors gave her when she was diagnosed. Unfortunately, Ms. Harris has exhausted is rejecting all of her treatment. The doctors have tried chemotherapy, radiation. She has been giving multiple medications, and she is rejecting all of those treatments currently. It's very hard to maintain her nutritional status. Her electrolytes are always imbalanced. She has a hard time keeping down food of any kind. She constantly rates her pain on a 9 out of 10, no matter when you talk to her during the day. She cannot ambulate much. She is mostly in the bed and rarely receives any visitors, as she has no family or friends, because she's been in the hospital for such an extended period of time. She is a sweet and gentle soul, but she is suffering continuously and has asked repeatedly if I would help her assist in her suicide, as well as her doctor. So the question is, would you help Ms. Harris assist in her suicide? While we're giving these scenarios, it is difficult to say what we would do as nurses in this situation. That is the challenge that we are faced with when dealing with assisted suicide. There are multiple barriers when trying to overcome this challenge. You have the morality of the issue. Is it moral? Is it right or wrong? That's a personal thing that you as a nurse have to answer. Do you think that this issue is right or wrong? Would you support the patient's decision whether you felt it was right or wrong? You have ethical barriers in nursing. As we know, nursing is a very ethical practice, and part of the ethical implications of a nurse is to follow the code of nursing and the letter of the law, where there are many legal implications. The only state that has authorized physician-assisted suicide is Oregon currently. So are you willing to break the law in order to assist a patient? You have your personal beliefs as a nurse. Do you personally believe in suicide? Do you believe that patients have a right to determine whether they want to end their own life? There are multiple personal beliefs that you as a nurse have to deal with before you can properly assist a patient in taking care of them. And then the final barrier is, which patient do you decide to help? There has to be a standard of care if you're going to legalize this physician-assisted suicide. Which patient has the right to have their request honored? Is it the patient who has continuously smoked for 40 years, who has done this to himself and is tired of living and now wants the easy way out? Or is it the patient who had no choice in the matter? It was a cancer, this disease that they have been dealing with for 10 plus years. There has to be a standard of care across the board and a standard by which you choose to help a patient. So here are some of the moral and ethical considerations. It is the stance of the American Nurses Association that nurses should not participate in assisted suicide but deliver appropriate care at the end of life. So that is the professional nursing stance of the American Nurses Association. Um, Apart from that, you have to have a personal stance of whether you as a nurse believe that assisted suicide is right or wrong. And you, as a nurse, you would have to assist the patient. Are you going to assist the patient? That's an ethical consideration because it is out of the scope of practice of a nurse to assist in any medication delivery or without a doctor's order. And then, how we decide which patients are honored is a ethical consideration. There are also ethical implications on the practice of nursing as a whole, not just personally, but on the whole practice of nursing. Okay, legal barriers. It is against the law in all states except for Oregon for a physician to assist in suicide. One of the famous cases of Dr. Kevorkian was doing assisted suicide in Michigan and actually faced legal consequences for his actions and was tried in a Michigan court and found guilty. And he only served a few years of his 15-year sentence, but he was still found guilty because it is illegal. So you have to weigh your legal risk against the wanting to help someone out. You could have jail time if you're convicted. You would also lose your job more than likely as a registered nurse. Opportunities for overcoming this challenge. You can provide outstanding patient care. You can educate your patient on other options as well as become educated yourself as a nurse on how to deal with this challenge. Pain management is a huge opportunity. And also becoming involved as a professional nurse in legislation affecting your country. Ways to provide outstanding patient care. Dr. Quill states that much unnecessary suffering can be relieved by helping patients who are not receiving the standard palliative care to gain access to it. Most of the time, people who are dying, if they don't have the funds or the access to standard care, they're miserable and they don't want to live anymore because they are not getting pain medicine. They are not getting IV fluids, electrolytes. They don't have assistance with bathing. So they're just left in a state where they are helpless and it's not a conducive way to live. Outstanding patient care includes your pain management. Almost every patient that is in the hospital is dealing with some sort of pain. You have to provide emotional support for your patients. That sometimes being just an ear to listen to and to talk them through something will help a patient rectify some of their thoughts if they are just, thinking out of their head for a minute. Being your patient's biggest advocate is something that is very important for nurses. As a nurse, you will be the first point of contact and the continuous point of contact for that patient. And in a Dutch study, it was said that 45% of patients speak first with their nurse about assisted suicide rather than anybody else. You also need to know your limits on your scope of practice when providing that patient care. You are a nurse, you are not a physician, so you have to know that you are not allowed to do anything without a physician order as far as medication or changing the status of your patient's life. Okay, education. You need to be educated about physician suicide, educated about your legal considerations, pain management education, and if you need further education for your patient, you should always consult a psychiatric doctor or nurse to come and help your patient to see if they are mentally ill or if there are other things behind them wanting to end their life. Nurses need to be educated about the management of pain, the control of symptoms, and related issues in the care of the dying and critically ill. Okay, pain management. There are multiple types of ways to manage pain. You have different mechanisms like relaxation techniques. There are pain medication we can give patients. You can give a back rub. Sometimes applying heat or cold can help to relieve pain. So before we rush to push for a pill or exhaust all of our options, we can try other relaxation and non-pharmacological techniques as well. Patients do complain of pain mostly in the hospital, and that's when they're there getting lots of pain medicine. There are times when uncontrolled pain can lead to altered mental status, and patients feel that this pain is just so unbearable that they don't want to live like this anymore. And that is when you would really want to try effective pain management to prevent those thoughts. Legislation. There are multiple ways where professional nurses can be involved in the legislation of our country. First, by researching and providing evidence-based practice to change legislation, to update it, to change in the community of medicine as a whole. As nurses, we are involved in the day-to-day life of patient care, and so we have a lot of evidence-based practice that we can put into play regarding these challenges, like physician-assisted suicide or assisted suicide in general. You have professional nurse involvement on hospital committees. You have professional nurse involvement on committees that are in Washington that have a voice to those legislative branches like the Supreme Court, who are actively involved in making a difference. And you can become one of those people on a committee as a professional nurse. There are multiple court cases regarding physician-assisted suicide, like the ones in Michigan, most famously for Dr. Kevorkian. And it is becoming a more and more popular, more talked about means of a person choosing a way to end their life. So staying up to date on the legislation and being involved in that legislation is a way to overcome that barrier and be involved as a professional nurse. In conclusion, regarding the state of Georgia and nurses in Georgia, it is illegal to assist in the suicide of a patient, knowingly assist in the suicide of a patient. There are many patients out there suffering in hospitals, and there are many patients dying every day, and there are many moral, ethical, and legal considerations we have to take into account as nurses when physicians want to assist in suicide, when patients are begging you to help them. It is the role of the nurse to provide ethical patient care no matter what the condition is of the patient. Sometimes it's hard because as nurses, we are taught to care for our patients, and we are with them so much that you hate to see them in this condition. But as a nurse, you are in the role of an ethical figure and a professional figure in the nursing industry. And finally, you want to exhaust all of your resources for management of pain and symptoms to make the critically ill and dying patient comfortable. At the end of the day, it is your choice as a nurse whether or not you decide to assist in the suicide of a patient who asks. And these are our references.